You said that the US, we don't have a healthcare system. We have a disease response system. And you are right,
Yes.
right? Over 50% of Americans are suffering with one of the top five chronic diseases. We are in the trillions in our healthcare spending, and yet we still suffer from poor health outcomes than other developed nations, and our life expectancy continues to decline. So, can you talk about this model and how you propose that we shift toward a true healthcare system that is focused on wellness and prevention instead of disease responsiveness?
Imagine that nurses were in charge of healthcare for a community or a zip code in the United States. What would they do? They would go in and assess the community. Then they would take that assessment and they would share the results with the patient, who would be the community. They would work with the stakeholders and they would look at what resources are there, and they develop a care plan for the community. Healthcare must be local. It can't be from Washington, D.C. Because the needs of every zip code are different. And the precious time that both physicians and nurses have with their patients has been minimized. And we have been given task after task after task, and we're task saturated. So we need a different system. And I think the biggest message that I'd like to get across is the research by Donna Bedian that says, the structure dictates the process, which dictates the outcomes. Now, you just beautifully summarized the outcomes of what the health is like in the United States. And yet, even on a governmental level, we've got people changing the processes. Oh, let's do value-based. Oh, let's do this. Oh, let's do that. But that's not the problem. The problem is that the structure in healthcare, we're structured as a business, and there are many people making billions of dollars on sickness. Okay. And because of this is not aligned with the values of either nurses or physicians, that we profit on disease. So until we change that, nothing is going to significantly change. So how do you change that? Well, you look at models that have worked. Public utilities are something that's uniquely American. And Roosevelt said, if, quote, and there was a precedence for this too. In the 1940s, he said, if there's an essential service, and he was talking about electricity, if there's an essential service that people need, you can't deny it, and it's exploited, then the public has a right to take it back. Okay, so we have a right as a public to take it back and make it local. But, there's some public utilities that are moneymakers. So that word does not resonate with people. So that's why we say the adaptive public utility model, because this is transparent and it's owned by the community.